The Philippines broke its single day record high of cases with over 26,400 cases reported yesterday. With this rapid rise in infections, the PGH is seeing an uptick in admissions, but fewer patients are reportedly presenting respiratory problems. But despite the alarming figures, the WHO insists that Omicron is less severe than previous variants. And after initially advising against it, the government is now encouraging the use of self administered COVID test kits. Fast, focused, and fearless. Here's everything you need to know to jumpstart your Sunday. I'm Riza Diaz. The health department logged 26,458 cases on Saturday, the highest number of single day case recorded in the country since the pandemic started. The previous record was in September 2021, where the DOH recorded some 26,600 or 300 cases. The total active cases now stands at over 102,000. Now, around 265 people died from the illness on Saturday, bringing the death toll to 52,000. Meanwhile, over 1,600 people recovered from the virus. Total recoveries are now at 2.7 million. The positivity rate for Saturday was also at an all time high at 43.7% out of the 77,000 tests done on January 6. The health department is now drawing up rules to allow the use of at home COVID test kits after initially advising against it. Mobile journalist Pamela Vasquez gives us a front seat in the story.
As the country grapples with yet another surge, the health department is caving. It's now looking to approve self-test antigen kits and will release guidelines on their use by January 17. This will cover rules on waste disposal, interpretation of results, and what action should be taken when it comes out positive. At the moment, none of the at-home COVID tests available on the market is approved by the FDA.
Not all antigen tests are created equal. Iba ang antigen test na ginagamit ng mga trained healthcare workers. Na iba ang direksyon at mas malalim ang pagkakatusok sa ilong.
This comes shortly after the Food and Drug Administration opened the door to manufacturers of self-administered rapid antigen tests.
I am calling for all the manufacturers and even the importers of self-administered COVID-19 test kits that to register their product in the form of a special certification.
Antigen tests are usually only recommended for those who are already exhibiting symptoms. Also, different brands have different sensitivities. For example, Abbott has a validated result sensitivity of up to 97.83%. Korean manufactured Nowcheck antigen test has a 91.4% sensitivity, while China manufactured Wonvo has 92.2%. The FDA has also been warning against the use of uncertified test kits, including brands like Longin and BioEasy.
Kailangan po guided kayo ng healthcare workers pag ginamit nyo to. And there is possibility of maling resulta at ito ay pwedeng magbigay ng false sense of security.
The national government may even subsidize at-home test kits once they are approved by the FDA, according to acting presidential spokesperson Carlo Nograles. Mobile journalist Pamela Vasquez, We Are One News.
The Philippine General Hospital is now getting more crowded as admissions creeped up due to the uptick of COVID-19 cases. Speaking at the Laging Handa briefing yesterday, PGH spokesperson Dr. Jonas Del Rosario said that the hospital currently has 255 admitted COVID-19 patients. However, this time he said there are fewer patients with respiratory problems. He added that the bed occupancy for COVID is now at 80%, while the ICU utilization rate is at 100%.
So we have 255 COVID patients po na naka-admit sa PGH. Tapos po pag tinitignan namin yung proportion ng vaccinated at unvaccinated, halos pareho lang. Yung critical or severe na mga cases, hati din po, no, unvaccinated and vaccinated.
We'll be back with more stories after the break. Keep it here on One News. You're still watching One News Now. I'm Riza Diaz. 2 years into the pandemic, the special risk allowances of healthcare workers in the front lines remain measly. Margan Enriquez with the story.
Despite risking their lives during the pandemic, healthcare workers are dismayed over the meager special risk allowances they received. Among them is Dr. Beng Rivera Reyes in Camarines Sur, who only got around 2,000 pesos worth of SRA in her 6 months of duty. Some of her colleagues only received 300 to 600 pesos. Others received none. Dr. Beng said the amount of SRA they received may have been computed based on the days that they were exposed to COVID-positive patients and not for the whole duration of their duty. Medical frontliners have time and again appealed that all of them should receive special risk allowances. But for now, they are only entitled to a 5,000 peso SRA. Even the president himself finds this amount too measly.
They should be given more. Take into account the possibility of danger. They themselves will get because of they have to go near and they have to treat those people. I will increase, hindi ko pa masabi magkano.
But the Filipino Nurses United notes that most healthcare workers do not receive any benefits.
Marami pa rin sa aming mga kasamahan ang hindi nakakatanggap o kulang ang natatanggap. Kung kaya't last quarter of last year, di ba, kinalampag namin ang Department of Health.
Another problem is that more and more medical workers are getting sick.
Almost mga 30 to 50% ang nababawas sa manpower nila sa ospital. Kaya ang isa sa mga panawagan ng ating mga nurses ay magkaroon ng augmentation o pagdagdag.
For his part, Health Secretary Francisco Duque III assures health workers that hospitals from other regions can augment the much-needed manpower in Metro Manila. For News 5, Marian Enriquez, we are One News.
Many countries are overwhelmed with the number of cases brought by the spread of the Omicron variant. Now, despite this, the World Health Organization insists that the new variant is less severe than previous ones. Let's watch this.
So Omicron, the latest variant of concern the WHO is tracking, has been detected around the world. It is efficiently transmitting, and in fact, everywhere where we have good sequencing, this variant is being detected. So it is circulating globally at the present time. What we are seeing is a very sharp increase in case numbers. You will have noticed in the latest WHO update, almost 10 million cases reported in the last 7 days. And that's the highest number of cases we've seen to date. In the last 24 hours, it's been almost 2.5 million cases, or more than 2.5 million cases. So there are several reasons why we're seeing such a sharp increase in case numbers. First is the emergence of Omicron and the circulation of Omicron, which transmits very efficiently between people. There's a number of reasons for this. First is the mutations that it has. The virus is able to adhere to human cells more easily. It has mutations that allow it to do that. Second is that we have what is called immune escape. And this means that people can be reinfected, either from if they had a previous infection or if they've been vaccinated. Now you have to remember vaccines are incredibly effective at preventing severe disease and death, but they don't prevent all infections and they don't prevent all onward transmission. So it is still absolutely critical to get vaccinated because it will save your life, but it doesn't prevent all infections or transmission. With regards to the severity of Omicron, we're learning more about this every day. What we understand from a number of countries and the studies that are coming from a number of countries is that your risk of developing severe disease or needing hospitalization from Omicron is less compared to Delta. That doesn't mean that it's a mild disease. It does mean, though, that if you are infected, that your chances of needing hospitalization are less. What we do know also from a number of countries is that your risk of developing severe disease increases with age, and that's the same as with Delta. It also increases if you have underlying conditions, and of course, it's increased if you're not vaccinated. So this is why it is so critical that when it is your turn, that you get vaccinated, that you receive the full dose, because vaccination is saving lives. Vaccination is preventing people from developing severe disease as well as going on to dying, and that's true for Delta as well as for Omicron.
And those are the top stories of the hour. Join us later again at 9 in the morning as we continue to monitor the day's biggest stories. You can also catch One News on Signal Play app. Register for a free account now at www.signalplay.com and stream One News live anytime, anywhere. I'm Rita Diaz. Mask on, wash hands, and stay safe, Philippines. We are One News.